Some of the biggest frustrations in healthcare are not from medicine or from technology. It's from the friction between the two of them. As many of you in this room already know, the clipboard is not the problem. It's a symptom of something much bigger. It's a symbol of healthcare, of a healthcare experience where patients are still expected to carry their story from one place to another, repeating their history, rewriting their medications, and hoping the right information somehow reaches the right person at the right time. And on the other side of that, providers are still spending too much time piecing together context instead of starting with it. That's why I'm so excited about this effort. When I first heard that Altera had pledged in the EHR category and would be working with the Kill the Clipboard initiative, I literally almost fell out of my chair. Because this exact challenge, the frustration that it creates for patients and providers and the impact that it has on care is what has been the center of my work for the last 15 plus years. And to be clear, our industry has come a long way. The progress made in interoperability over the last 2 decades is real and important, but anybody in this room really understands that there's still a meaningful gap between having data technically available and it actually showing up in a way that helps care happen more effectively. What makes this especially exciting is that so much of the work in our industry and in our sector is driven oftentimes by regulatory requirements, compliance demands, and the very real administrative burdens our clients and caregivers deal with every single day. But this is much different. This is one of those rare opportunities to solve something that is not only deeply practical, but is also deeply human. For the patient, this will mean less frustration, less repetition, and less of a burden falling on them, their families, or their caregivers to connect the fragmented system when they're at their most vulnerable. And for the provider, it means less digging, less guessing, and less working around technology, and more time focused on the patient right in front of them. And that matters deeply to the kinds of hospitals I have served my entire career and Altera currently serves now, which is community, rural, and critical access hospitals, where timely access to outside information can make a very real difference. But too often, it's still not there. So to me, Kill the Clipboard is much more than digitizing intake. It's about reducing patient frustration, improving care, and making sure the tools we build actually make sense for the clinicians and caregivers that are expected to use them. Because if we get this right, we don't just improve workflow or make things easier. We'll make healthcare feel better, the practice of medicine better, deliver better patient care, and ultimately make America healthier again. Thank you.